Hi everyone, it's Linda McKenna from Golden Rule Senior Placement Services coming to you today with Tuesday Talks. This is the last week in November, and we're going to recognize November being Home Care and Hospice Month, also known as Home Health Month. During this month of recognition of home care and hospice services is knowing the extent of the services rendered and showing our appreciation of the compassionate care that is given to our senior loved ones during this special time of all their needs. And having worked in both of those industries, there is some dynamic people that have dedicated their mission, their focus, and their lives to taking care of others. And there is no special time in being involved with patients in a home health situation at their home and in hospice. Being part of somebody's last chapter is definitely a gift for the one that is giving to that loved one. So home health and home care and hospice is really special to me because I worked in that industry, like I said, for a very long time, and I was surrounded by the best of the best. And so many life lessons that I learned from these clinicians that I was able to parlay over to my own family members, but also into my business at Golden Rules. So as you know, I'm such a strong patient advocate. And when my seniors go into a senior living community, I always order home health with the doctor as well too. I think that is a necessary part of the transition process, but also ways of alleviating the overwhelming effect of it all and having somebody also to be over that person. And hospice, there's so many levels of hospice, and when it comes to that time, may it be palliative, respite, or end of life, it is such a incredible service to those that are sick, those that are dying, and our senior loved ones who really are at that last chapter and the last pages of their lives that we need to embrace with hospice as well. So to give you a little bit of history on both entities is National Home Health Care and Home Care Hospice Month is in November, when we honor all professionals who work in the broad field of home care, home health, and hospice work. And that includes physicians, nurses, aides, social workers, physical therapists, chaplains, and so much more. The history of National Home Care, Home Health, and Hospice Month actually started with professions back into their roots in 1963, when Dame Cicely Saunders gave a lecture at Yale University on the idea of specialized care for those at the end of their lives. Only 2 years later did Dr. Saunders was invited to become faculty at the Dean of Yale School of Nursing, Florence Wald. Dr. Saunders went on to establish the first hospice center, St. Christopher's Hospice, in the UK in 1967. Florence Wald took a sabbatical to observe work in the centers 2 years later. In 1974, she founded Connecticut Hospice in Brantford, Connecticut. That's where Yale University is. Part of this legislation that was introduced about funds and hospice programs was the fact that there was a spurred on vision on death and dying, which was actually a book written by Dr. Elizabeth Kubler-Ross and outlined the last stages of life for the terminally ill. So she actually brought this to Senate, and a bill was passed for the terminally ill and to how they can die with dignity. And that's when the 1979, the National Hospice Organization was established to promote hospice care as a concept. Then on the 25th anniversary of Medicare hospice benefits was celebrated, and the Department of Veterans Affairs launched an effort to increase veterans' access to hospice. So, what are the 5 things that we should know about home health care and hospices? is unpaid hospice workers. Over 15 million Americans become unpaid caregivers for the elderly or disabled. That means family members or those that are helping in the home, not necessarily they are paid because they are family caregivers as well. 2, a growing demand. By 2025, which is next year, there will be 1 billion seniors in the world, many of whom will require hospice or home health care. While the senior population will quadruple by then, the population of caregivers is only set to double. So they are increasing as well. 3, below minimum wage. As of 2016, the whole of the caregiver workforce earns a median hourly wage of just $9.25 an hour. Agencies keep 60 to 70% of the patient's payment and or share of cost is also. A lot of people don't realize that as well too. But if you're privately paying for it, it is as much as $25 to $35 an hour. So a lot of those folks are not paid at a high rate as well. 4, agencies abound. About 12,000 home care and hospice agencies in the United States, up from 6,800 in 2001. So that almost doubled from 2001 to the present time. 5, technology is revolutionizing in home care. Technology is increasing by using home care workers to track things like medication and vital sign, as well as offer telemedicine and up-to-date care plans. So what we were doing things in paper years ago is now done electronically. There is some telehealth visits as well that they can be in place, but a physician, nurse practitioner can get involved by telehealth. But there's also a great platform that not only families can get involved with the electronic records, but also that each discipline is now electronically engaged in that patient's care. So yes, it's revolutionary, not only for home care and hospice, but it really means that everybody's on the same page, electronic page. Why we love National Home Care and Home Health Hospice Month. Home care provides dignity for many. Home care and hospice workers believe that those at the end of their lives deserve the right to pass peacefully and on their own terms. The elderly often prefer to stay at home in the comforts of their home where they feel freer and less risk of contacting other illnesses. So home health is definitely that, and that's skilled care. End of life is the same thing as you could be at home or in a care center as well. The essence of home health care makes this level of freedom available to many who otherwise would have not had it. We realized how imperative during COVID, how home health really went out of that circle because guess what? A lot of folks could not rehabilitate, or after hospitalization with COVID being so prominent that they were rehabilitating at home after hospitalization. So what better benefit is actually getting care at your home with nursing, therapy, and aid visits as well. 2, this month gives us a chance to improve caregivers' lives. It's a break. I'm not going to deny it any much more, even if somebody is in senior living or adult family care home or memory care unit, is the fact that this is a little bit of time that these individuals that come to assist with the care plan and take care of somebody gives them a little bit of break. For the private duty home care companies, yes, it is that it's privately paid. Some have long-term care insurance that have coverage with it. It is that caregiver, it's 24/7, as we know, taking care of somebody that is very ill at home or is dying at home. So there is no breakaway. So having a service come in privately to the home gives that person the ability to go shopping, do their own care needs, maybe take a nap. So this way they can revive themselves for being available throughout the day and night for their loved one. Number 3, it proves the healing power of home and loved ones. The elderly who wish to retain the freedom of staying in their home and ending their lives on their own term experience true psychological benefits. A lot of people passing at home really feel that as well, rather than it being so clinical. There's wonderful care centers and there's wonderful care homes and hospice houses, but a lot of people prefer that, so they could be surrounded morning, day, and night with their loved ones for their passing as well. How to celebrate National Home Care and Hospice Month is 1, celebrate hospice professionals and home health professionals. Thank a nurse. Just because the doctor ordered and physical therapist ordered for your loved one to come to your home, and the same thing with hospice, make sure you thank that person. It makes it go a long way. I've seen so many of our nurses go beyond, and therapists go beyond the time that they're supposed to spend there, is actually sit with family and say, this is what I'm thinking that needs to be done with your loved ones. So that's their special time. Some of them work, like I said, some of them are volunteering their time, but just don't take it for granted that those people are there for a purpose. They're there also for your emotional support as being the caregiver. But they're special people. And, chaplain services are wonderful for hospice as well. But therapy through home health is great. It's making somebody have a goal to get better and to move, to ambulate. So if that therapist is not a driving force, it's status quo, that person is not going to progress into a further quality of life. So, celebrate them, not only through this month, but also every time that you interact with them. 2, promote awareness of issues and hospice workers. Yes, they are underpaid in a lot of cases, but some are not. But look after them as well too. A lot of companies deny you giving any kinds of gifts or anything of that nature. Some allow that. Maybe something for them, even complimenting them to their bosses makes all the difference in the world. Testimonials are important to me, because when somebody looks on my website and seeing other people satisfied with my services makes me even more driven to accomplish what I do. So imagine you doing that for a nurse, a therapist, aides, or whoever who's coming out to your house for home health, for home care, or for hospice. Recognize them. It's what they call the gem, is them going the extra mile. So recognizing them is really important. We tend to complain and document it, but giving a compliment goes a long way. 3, visit a loved one in home health and in hospice. Don't take it for granted that somebody is visiting them. So you visiting them in their home while they're under home health or home care is breaking away from the medical component, also from hospice, is actually having a visit. So it's not about that you being the caregiver or anything of that nature. It is that you are there to visit and actually spend time with your loved one. So, I tend to agree with senior living during this time as well, if that it's not appropriate for them to be at home. Remember, home health can be utilized in senior living as well as hospice. And so there is more around the clock care. That means the nurses from those facilities or aides from those facilities are taking care of them, not only when home health is engaged or hospice is engaged. It's the other caregivers that are at these residential care homes or assisted living homes or communities. So keep that in mind. As always, I thank you so much. Next week, we start a whole new month. It is going to be December, so we're going to be talking about the holidays and in preparation for our senior loved ones. But as always, I lead you to my website. It's www.goldenruleseniorplacement.com. There you will find my demographics, meaning my contact information, also my bio. You will see my testimonials, as we just spoke about, but also various options on senior living, resources, and a whole library of things and topics that we talk about for our senior loved ones to help you migrate through this overwhelming time. As always, thank you very much for viewing Tuesday Talks with Linda McKenna and Golden Rule Senior Placement Services. Have a blessed week and see you next month in December. Have a blessed one. Bye-bye now.